Hello, guys, and welcome back to today's episode of Learning. How are you doing? I'm hoping you are doing well. And today I want us to discuss about a very interesting topic, a disease that is somehow common, known as TB. And I understand you've heard about TB, and so today I want us to learn on what is TB, how can one get it, and what can you do just in case you find out that you have the symptoms. And TB is an infection to the lungs. It's an infection to the lungs, and it's caused by a bacteria called Mycobacterium TB. TB affects mostly the lungs, but if it's left untreated, it can affect any other part of the body. Actually, TB affects every part of the body except the nails and the hair. Those are the only two parts of the body that can't be affected by TB, but the rest of the body, the rest of the organs can be affected by TB. So today we will concentrate more on TB of the lungs, and that is the most common one. So TB is spread from one person to another through the air. That is if someone who has TB coughs or sneezes or sings, he can transmit the TB bacteria. So when they talk or when they sing or sneeze or cough, they release the bacteria to the air, and the next person standing or seated next to someone who has TB can be able to get TB, because when they cough, they release the the bacteria to the air, and so someone who is next to them you inhale the bacteria, and then it goes in and settles in your lungs. And once they settle in your lungs, they just begin to grow or they begin to multiply, and that is how they cause an infection to your lungs. So TB, not everyone who inhales the TB bacteria can get a TB infection. You find out that many people might be having the TB bacteria in their bodies, but it doesn't develop to a TB disease. But once your immunity system is low, now when your immune system is strong, you can be having the TB bacteria in your body, but because your immune system is strong, it fights the bacteria so that it won't multiply. But when your immunity system goes low, someone can live with the TB bacteria for long, but once the immune system becomes low, maybe because of another chronic underlying disease, the TB bacteria now they can again become active and start multiplying, and they can cause a TB disease. I hope you have understood what is TB. It's an infection to the lungs caused by a bacteria called Mycobacterium TB. And how is it spread? It's spread from person to person through the air. It's airborne. And so anyone who has TB, if they cough or sneeze or talk or sing, they release the TB bacteria to the air. And once you inhale them, they go direct to your lungs, they settle there, and they start multiplying and cause a TB infection to your lungs. And so, as I have said, TB, we have latent TB. That is when now someone can contact the TB bacteria, it goes in, settles in the lungs, but it's not able to multiply, or it's not able to grow to cause an infection when your immune system is well. But TB disease is when now the bacteria that you inhale goes into your lungs and start to develop, or they start to grow and multiply to causing a TB disease. What are the symptoms of TB? What are the symptoms of TB? Number one symptom of TB, someone has a cough for more than 3 weeks. If someone coughs for more than 3 weeks, we have chest pains, we have coughing blood, we have weight loss, we have night sweats, we have loss of appetite, we have fever, we have chills. Those are the symptoms of TB. Number one, cough that lasts for more than 3 weeks. We have weight loss. You just notice that within a very short period of time, you have lost kgs, your kilograms. And then there is night sweats. If you sweat at night, you're coughing, you have lost your kgs, and you have night sweats. We have fever. They run temperatures of above 37.7. We have loss of appetite. We have fever, chills. We have the cough blood or sputum. And then there's fatigue or lethargy. You just get tired easily. Those are the most common symptoms of TB. If you find out that you have these symptoms, please visit the nearest health facility so that you can talk to your doctor, so that you can get tested for TB. What are the risk factors of getting TB? Risk factors. Who is at a risk of getting TB? Number one, we have people who have a weak immune system. People who have a weak immune system. Who are these people? Number one, we have people who are living with HIV. People who are living with HIV, their immune system is low, and they are prone to getting TB. Mostly, these people, they are prone to getting other infections, including TB, because the immune system is low. We have people who have diabetes. The immune system is low, they can get TB. People who use corticosteroids. The corticosteroids tend to lower someone's immune system. People who have kidney diseases, they are also prone to getting TB. We also have, if you have once had a TB infection, you are also at a risk of getting TB again. If you once was infected with TB, it can recur again. So if you ever had a TB infection, you are also at a risk of getting TB. And how is someone exposed to TB? You are exposed to TB if you spend time with someone who has TB. If you spend time with someone who has TB, then you are exposed to TB. And it's hard to know when someone has TB, especially if you are not a medic. You can't know. You might think someone has just common cold, but they might be having TB. So what to do not to expose yourself to TB? Avoid people who are coughing, and also when you are in a crowded place, like when you are in a matatu, when you are in a matatu, just ensure that the windows are open, because you don't know who is seated next to you. They might be coughing. You think they have just a common cold, but they might be having TB. So just open the windows, ensure the place is well ventilated. So how can we prevent TB? How can we prevent TB? Number one, avoid contact or avoid prolonged time with the people who are coughing. Number one, avoid contact with anybody who is coughing. Avoid crowded places. Avoid enclosed environments, like if you are in a room and you are many and the place is not well ventilated, and it happens that there's someone there who is suffering from TB, then it means he's going to spread to TB to all of you. And also those people who are working in hospitals, like essential service providers. Nowadays, we have masks. So just ensure that you put on your mask when you are attending to patients with COVID. Those people who are in prisons, ensure that your environment is open, or if you're in a closed room, ensure that the windows are open, the place is well ventilated. And those people who work in setups with TB patients, please ensure you wear face masks. Those people who are at high risk, like people who have HIV, people who have had a TB infection, like for the last 2 years, young babies, people who use drugs, those people who inject drugs. We have the elderly, we have people with weakened immune system, and we also have people who didn't complete their last dose of TB. Those are people who are at high risk of getting TB. All those people who I have mentioned, make sure you are not you're a group of people who can get TB very fast. So make sure you protect yourself. So there's a TB vaccine called BCG that is given to babies at birth. Moms, those new mothers, make sure before you leave the hospital when you have given birth, make sure your baby has been given a TB vaccine called BCG. That vaccine helps in preventing people from getting TB. You know the BCG vaccine? Mine is here. I know you can, if you can check on your left hand, you can see this is what we call a BCG vaccine. It's here. This one you are given at birth. So make sure your baby gets this vaccine at birth in the hospital before you leave. Or if it's not available in the hospital at that particular time, make sure you follow up with the doctor, or ask them when it will be next available, or go to the next facility so that your kid can get a BCG vaccine. This is the vaccine that helps us to prevent us from getting TB. What are the tests done in the hospital to diagnose TB? Number one, we have symptoms. When you go to the hospital and tell your doctor your symptoms, you have a cough, you have chest pains, you have night sweats, you have weight loss, you have loss of appetite, you have a fever, you are coughing for more than 3 weeks. Clinical diagnosis. Through the clinical symptoms, the doctor can tell you might be having TB, but you will do a chest x-ray. A chest x-ray will show if you have TB. We also have sputum tests. The doctor will send you to give a sample of your sputum. It will be tested, and that one will tell whether you have TB or not. Okay. Who should be tested for TB? If you have spent time with a TB patient, and you feel like maybe you have been exposed, you can be tested. People who work in a setting that has TB patients. If you work in a setting that has TB patients, maybe in a hospital, in that isolated room where patients with TB are, and they feel like maybe they have been exposed, they can be tested. All healthcare workers, because in the hospital, you might have pumped to a patient with TB and you didn't know. All healthcare workers can be tested. And we also have people who have had TB, maybe in the last 2 years, and they have started having those symptoms again. They also can be tested. What are the medications? What are the medications for TB? Just inform your doctor. Go to your doctor. If you are diagnosed with TB, then he will talk to you on what medications you are needed to do to take. They will be prescribed to you. And if you are pregnant, make sure you inform the doctor, because there are some medications that you might not be given, or that are contraindicated during pregnancy. So if you are pregnant, make sure. And always, when you are pregnant and you are visiting the hospital, make sure you inform the doctor. Always, not only the case of TB, always when you go to the hospital, you have been treated and your doctor is prescribing medications. If you are a pregnant woman, make sure you tell your doctor, because there are so many medications that are contraindicated during pregnancy. So make sure you tell your doctor, so that you cannot be given those medications that will affect your baby. A point to note. TB can become resistant to medications. TB can become resistant to medications. How? You have to note that it is good to finish your dosage as prescribed by your doctor. You have to finish your dosage. Number 2, you have to take the correct dosage of medications. If you are told by your doctor you need to take 2 tablets at night, make sure you take 2 at night. If you are told take 3 at night, make sure you take 3 at night. If it's 4, make sure you use 4 at night, because if you underdose, maybe TB medication is prescribed using your weight. So some can take 2, some can take 3 or 4 according to your weight. So if you are required to take 3 medications, 3 tablets, and then you take 2, that means you have interfered with your dose. And by doing that, the bacteria can become resistant. It can become resistant to medications. And drug-resistant TB is hard to treat. It is hard to treat because, and also the duration. The normal duration of a TB medication is 6 months. Imagine 6 months, guys. So you can see how serious TB is. For 6 months, every night you have to take medications. But when you don't take medications as directed by your doctor, and then TB becomes resistant, then you will have to take drugs for a longer period of time. Your doctor will tell you, just in case you you get drug resistant TB, the doctor will tell you on how you will go about it. What are the effects of those anti-TBs? Adverse. Every medication have effects, but these ones, if you get them and you are using anti-TBs, you are required to go back so that your doctor can check your dosage and adjust it. If you notice that you have unexplained weight loss, you are on anti-TBs and then you start losing weight, unexplained, Alani, I don't know, unexplained, you understand, and you lose your appetite, you start vomiting, make sure you go back to the doctor. If you notice that your urine and your skin is turning yellow, also your eyes, you need to go back to the doctor. If you notice that you have vision changes, make sure you go back to the doctor. If you notice that that you bleed easily, you bleed, you lose blood easily, maybe you are pricked and you lose blood non-stop, make sure you visit your doctor. And if also you notice that you have a tingling effects on your feet, or you start becoming numb on your feet, you also need to go and see the doctor so that he can see, maybe he can change the medication, or the dosage will be adjusted. What are the complications of TB? The complications of TB, number one, we have difficulties in breathing because your lungs will be affected by the bacteria, and so it becomes hard for your lungs to breathe in enough oxygen. So number one, you will be having difficulties in breathing, and that will result in you being supplemented with the oxygen, oxygen therapy. And then we have something we call pleural effusion, fluid accumulation in your lungs, and that one is another complication that will require your doctor you will be required to go in for another procedure to drain all that fluid from your lungs. And we also have now the worst complication of TB, that is death, because we have TB deaths, and that is the worst complication. So guys, what I can tell you is TB is common, and it's so easy to avoid getting TB. Number one, in a matatu, make sure if you're next to a window, or tell someone who is next to a window to open the window, because you are crowded and you don't know if there is someone with TB. And also avoid people who are coughing. Because you might think they have a common cold, but in the real sense they have TB. So avoid people who are coughing, and those people who attend to patients with TB, make sure you use protective gears, wear your face mask, and wash your hands. Yeah, so guys, that is a brief discussion about TB, and I hope you have learned something, and thank you so much for coming back, and see you in the next session of learning.